Prostate cancer is the most common cancer in men. Treatment often involves surgically removing the prostate. Today, radical prostatectomy is usually performed using minimally invasive, robot-assisted techniques. During this procedure, lymph nodes in the pelvic area are often removed as well, in order to better assess whether the cancer has spread through the lymphatic system. A possible consequence of this lymph node removal is the formation of so-called lymphoceles, fluid collections in the pelvis. When lymph nodes are removed, lymphatic vessels are disrupted. As a result, lymph fluid can leak and accumulate in the pelvic cavity, where it may become encapsulated. Lymphoceles can remain asymptomatic. However, they need to be monitored as they may become infected. They can also compress blood vessels and thereby increase the risk of thrombosis. If symptoms occur, such as pain, infection, fever, or swelling of the legs, these are referred to as symptomatic lymphoceles. In such cases, treatment is necessary. This may involve placing a drain into the pelvis or performing an additional surgical procedure to allow the fluid to drain. To better prevent the development of lymphoceles, new surgical techniques have been developed. The creation of peritoneal flaps. At the end of the operation, a part of the peritoneum is positioned in such a way that a controlled opening is created between the abdominal cavity and the pelvis. This allows leaking lymph fluid to spread freely into the abdominal cavity, where it can be absorbed, instead of becoming encapsulated in the pelvis. At University Medicine Mannheim and the German Cancer Research Center in Heidelberg, we have analyzed the currently available scientific evidence on these techniques. To do this, we collected the results of 6 high-quality scientific studies from Mannheim as well as from 5 other centers worldwide. All 6 studies had a similar design. Half of the patients underwent surgery with an additional peritoneal flap, while the other half had surgery without a flap. The results were then analyzed together, including data from nearly 3,000 patients in total. The findings are clear. Patients with a peritoneal flap developed significantly fewer lymphoceles requiring treatment. As a result, the overall complication rate was reduced. At the same time, the duration of surgery was hardly increased by adding the flap. We also investigated who is at particularly high risk of developing lymphoceles with complications. We found that if an asymptomatic lymphocele is already visible on ultrasound at the time of hospital discharge, the risk increases significantly. What does this mean for you as a patient? If you're scheduled for a prostatectomy with lymph node removal, a peritoneal flap should also be performed. The scientific evidence is so clear that, in our view, this technique should become the new standard. So do not hesitate to ask your surgeon about it. After the operation, it is also important to perform an ultrasound examination before discharge from the hospital. If a lymphocele is detected, you should be monitored more closely by your urologist. In such cases, be aware of warning signs such as increasing lower abdominal pain, fever, or swelling in the legs. If these occur, seek medical attention immediately and present to a urological emergency department. Our goal is to help you get through your treatment more safely, with fewer complications and a faster recovery.